Your heart never stops working. Every second, every beat, it's trying to keep you alive. But sometimes, it starts to whisper for help before it screams. This is called congestive cardiac failure. Not a heart that's stopped, but a heart that's struggling. Today, I want to show you what that really means, how it begins, how it feels, and how you can protect the only engine your body will ever have. Congestive cardiac failure, or CCF, means your heart can't pump blood effectively. Imagine a traffic jam inside your body. The blood that should move forward begins to back up. That backup creates congestion. In your lungs, your liver, your legs, you start retaining fluid. Breathing becomes heavier. It feels like the body is slowly drowning in what it cannot move. It's not a sudden event. It's a quiet process. A tired heart trying to do too much for too long, until it finally starts to give up. And that's when you begin to notice the small things. That climbing the stairs feels much harder, that your ankles swell up at night, and that you're just always tired, no matter how much you rest. There are different phases of heart failure, and they affect you in different ways. With left-sided failure, the blood builds up in your lungs. You might develop a persistent cough, find it impossible to lie flat without feeling breathless, or even wake up at night, gasping for air. Then there's right-sided failure, where the blood pools in your body's extremities, your legs, your feet, your belly. You feel heavy, bloated, and perpetually weak. And sometimes you get biventricular failure, where both sides of your heart begin to fail at the same time. You can't always see it coming, but your body feels it. The heart whispers its struggle, and the body responds with exhaustion, swelling, and a desperate shortness of breath. CCF is rarely caused by just one thing. It's the final chapter in a long story of wear and tear. It could be years of high blood pressure pushing your heart to work harder. It might be coronary artery disease that has slowly starved the heart of the oxygen it needs. Or perhaps it's the result of heart attacks that have left scars, weakening the muscle. Valvular disease can force blood to flow backward, adding to the strain. Even chronic stress, a poor diet, and general neglect play a huge role. Over time, your heart, this small, powerful muscle that's worked so faithfully for you, starts to fatigue. It's not a failure born from weakness. It's a failure born from pure exhaustion. The first signs of CCF are dangerously easy to dismiss. You might feel a little short of breath after walking up a flight of stairs, a bit more tired than usual at the end of the day. You might just brush it off as getting older or being stressed. But it's not. Here's what your body is trying to tell you. Breathing becomes a conscious effort, especially when you lie down. Swelling appears in your ankles, legs, or even your stomach. You might gain weight rapidly, but it's not fat, it's fluid. You feel an overwhelming tiredness all the time, even after a full night's sleep. You might find yourself coughing more at night, unable to sleep, lying flat. These aren't random symptoms. These are your heart's distress signals, and ignoring them can cost you precious time you don't have. Diagnosing CCF is all about listening to the heart and to the signs your body is giving. Doctors use a range of tools to get the full picture. An echocardiogram allows them to see how well your heart is pumping. A chest X-ray can reveal if there's fluid building up in your lungs. Blood tests can detect specific hormones that are released when your heart is under significant stress. An ECG scan helps to catch any irregular heart rhythms. One of the key metrics they measure is your ejection fraction. That's the percentage of blood your heart pushes out with each beat. A normal, healthy heart pumps about 55 to 70%. In congestive cardiac failure, that number drops, sometimes to dangerously low levels, indicating the heart is struggling to do its most basic job. Now, while CCF can't always be completely reversed, it absolutely can be managed. Treatment focuses on helping your heart rest and recover whatever strength it can. This is often a combination of medication and lifestyle changes. Medications like diuretics help your body get rid of that extra fluid, relieving the swelling and pressure. ACE inhibitors and ARBs help your blood vessels relax so blood can flow more easily. Beta blockers are crucial for protecting the heart from overworking. And aldosterone blockers help keep your body's salt and water in balance. Just as important are lifestyle changes. Limiting salt, moving your body more, gently but consistently, and avoiding alcohol and smoking. It's about monitoring your weight every day and keeping stress levels as low as possible. For some, pacemakers or even heart transplants are necessary. But for most, discipline and daily care make the biggest difference. Living with heart failure doesn't mean your story is over. It means you're learning to live differently, more intentionally. Many people live full, meaningful lives with this condition because they learn to respect their limits and care for their hearts with newfound dedication. You learn to listen again to your breath, your heartbeat, the subtle signals from your body. You learn that healing isn't about achieving perfection. It's about being consistent. Every small positive choice, a little less salt on your food, a short walk around the block, getting an extra hour of rest, it all adds up. And believe me, your heart notices every single act of kindness you show it. Of course, the best treatment is always prevention. How do we avoid getting to this point? It starts with the basics. Keep your blood pressure in a healthy range. Eat whole foods, fruits, vegetables, lean proteins. Move your body daily, even if it's just a walk. Prioritize sleep, and learn to let go of what weighs on you, emotionally and physically. Stress is a silent killer. It doesn't show up on an X-ray, but it forces your heart to work harder than you realize, day in and day out. Taking care of your emotions is just as important as taking care of your physical body. They were connected to your heart more than you think. Your heart is doing its absolute best to keep you alive, even when you don't notice it. It beats, quietly, constantly, just to give you another chance at life. So please, take care of it. Eat better, rest more, let go of the stress that doesn't belong to you. Heart failure doesn't just happen overnight. It happens slowly when we stop listening to ourselves. This isn't about fear, it's about awareness, because the more you understand your heart, the longer it will stand by you. I'm the Psycho Nurse. Thank you for watching. Stay kind to your body. It's been fighting for you this whole time. Don't forget to like this video and subscribe for more content that helps you understand yourself better.